Dr. Yoshikawa is going to talk about, what kind of where we go from here. I mean, what are some potential solutions to some of these issues that Anna Johnson has been talking about? So, Hiro, welcome, and looking forward to hear from you.
Great, thanks for the invitation, and I look forward to, as we get to the Q&A, to interacting with folks in the audience. My presentation really jumps off from Anna's last slide around some of the ideas, and so it'll be some specific kinds of policy options that might be and program options that are responsive, I think, to the current crises. And it is true, we have a public health, we have an epidemic, a public health and economic, as well as a racial crisis going on right now in the United States. So it is a bit of a unique moment in American history. So I'm going to start with a little bit of kind of big picture thinking with a couple colleagues that we've been doing around what this moment represents in the United States as an opportunity. I know there's been a lot of discourse around reimagining education, and so I think we've been thinking a little bit more about what does it mean to rehumanize education in response to these crises. What COVID has done is to reveal the, as Anna has shown, kind of increases in poverty, the inequities that have existed and continue to exist in the United States, how they are laid bare when families and communities are bearing the brunt of the response and the harm, as well as the strengths and opportunities. This historic moment is one in which we can really think about an opportunity to strengthen families and communities. In the past few months, I've been involved in a couple initiatives, one of which was the Biden-Sanders Unity Task Force on Education, which was put together when Sanders, very soon after he dropped out of the race, but in an effort to make sure that the policy recommendations of Vice President Biden and the Democratic Party would provide some unified approaches and recommendations going into the Democratic National Party convention and into the fall, and meant to inform things like a transition process and a potential Biden administration. So I was one of the 8 members of the task force, and there is a document around those recommendations that most of which made their way into the Democratic Party platform, and some of which informed the Biden policies that have been announced over the past few months. Another was a review from a more global perspective of the effects of COVID on early childhood development and potentially the life course. What do we know from the literatures on kind of previous disasters, epidemics, on how those affect life course development. But I think Anna has done a great job of kind of outlining some of the main risks to families that have occurred in this pandemic, which are actually quite similar to those that occurred in kind of prior pandemics, as well as climate-driven disasters and those kinds of things. I can also refer you to a recent statement on a series of briefs from the Society for Research in Child Development around directions for addressing inequities in education during the COVID pandemic. We are in, this has hit during a period of kind of unique polarization in society. And so I think as we think about rebuilding a society and addressing these issues of poverty and public health, I think we also have to think of the social dimension. I just wanted to set a little bit of further context, which is that the divisions and levels of polarization and conflict across groups right now are unprecedented for both political reasons, for reasons of the racial justice crisis, which of course has been ongoing, but which has been highlighted since the killing of George Floyd, and the coincidence of that with the largest public health and economic crisis in recent times. How are these linked? And I can thank some colleagues of mine, Megan Bang and Naila Nasir, for some of our, this is actually some, an op-ed that we have drafted and is under review. What does COVID teach us? COVID teaches us, of course, that care for the self is inextricably intertwined with care for the other, right? So when it comes to a behavior as basic as wearing a mask, we are protecting ourselves as much as we are protecting others. At the same time, COVID has been an unprecedented stressor on families and communities. Families and communities have become, during the lockdown periods in particular, became the source of education, learning, support, mental health, well-being, food, and shelter, of course, for the nation's children and youth. What does this mean? I think we can think about the many local solutions that families and communities came up with as potential directions for support from public investment and public policies. We think there are new opportunities for civic engagement, for investing in communities, and for democratic participation in rebuilding the social fabric of our society. If we take the current crises of social polarization, political polarization in combination with the public health and economic crises, this is a tall order, but it is an opportunity to perhaps think about rebuilding some of the bedrock institutions of our society, which are perhaps not supported enough to withstand a crisis like COVID-19. And this includes, of course, a new potential to place racial and economic equity at the foundation of education systems. So what are some of the new evidence-based solutions that may be interesting to think about, to explore in your communities, to think about how to support and expand as we try to address the COVID-19 pandemic? I'm going to talk a little bit about opportunities at the family level, at the community level, and at the national level, both in terms of public policies at the national level and changing the national narratives around who is deserving of humanness. So one policy proposal that I did want to draw your attention to, because it might have kind of slid by a little bit in the past couple of months, was a historic proposed expansion of childcare and early education. And so this was announced by Vice President Biden as one of the 4 planks in the economic policy platform. It builds on legislation that Patty Murray had proposed, Senator Patty Murray from the state of Washington in 2019, which was called the Child Care for Working Families Act. And I think I want to highlight here that I think we are at a unique moment in American history when for that period of months when childcare and early education settings shut down, families bore 100% or close to 100% of the childcare burden of the country. As in the areas where lockdown happened, childcare and home learning was kind of all there was. There was no formal system of childcare. And so we are at a historic opportunity to maybe fix the childcare problem. Childcare subsidies are available for only a fraction of the eligible low-income families in the United States. For decades, despite some major expansions, it's remained under 20% of those who are eligible among low-income families are actually receive childcare subsidies. So what this proposed policy would do would be to triple childcare funding, more than triple the number of low-income, but also middle-class families who would receive relief for childcare. The fact is that childcare costs routinely cost more than 20% or more of family income for middle class and low income families, and in some cases approaching closer to 30 or 40%. At the same time, our childcare workforce is one of the very least supported in the country, with an average national wage of $10.82. Many with no benefits, these are primarily Black and brown women, taking care of children during that period of rapid brain development, which is actually the most important developmental period in life. So we have a complete mismatch here between both the resources available, the kind of support for the childcare workforce, and therefore threats to children's development, as well as implications for stress and the economic well-being of families and parents. What the proposal provides for is a child care guarantee, so that no more than 7% of income for low-income and middle-class families would be going to childcare, so a much more generous subsidy for children 0 to 3. And universal high-quality preschool, along the lines of some of the workforce supports and quality that was achieved in Tulsa and in the state of Oklahoma that Anna was talking about, and evaluated by Deborah Phillips and colleagues over the years. Importantly, the child care workforce will be supported with collective bargaining rights, work benefits, and professional development opportunities. What might the effects be? The calculations from these policy proposals are, again, a large expansion of the number of children served, greater access to center-based childcare for families in poverty. When we interview parents in virtually any study, and we ask low-income parents what form of childcare would they prefer for their children, a majority tend to say that they would like children in kind of well-equipped centers with great teachers, and yet they often cannot afford that. That is more expensive than the kinds of informal family down the hall kinds of childcare options that are called the less formal part of the childcare sector, home-based childcare. And these kinds of policies provide more support for center-based childcare. Center-based childcare, all else equal, improves child cognitive development relative to other forms of childcare in the United States among 0 to 3-year-olds. And we see that again and again in research. A better trained childcare workforce would result in the higher quality of the kinds of, and more of the serve and return interactions that build brain development, and higher quality in preschool provision, because we know that workforce professional development, things like in-service professional development and resources for coaching can really help in terms of quality. Turning to some of the other critical issues right now, the post-George Floyd events, the televising and the representation in media of the repeated onslaught of racial incidents and injuries and killings have families all over the country asking how much and how should we discuss racism with our children. And here I can refer folks to my colleague Diane Hughes at New York University, who has spent the past 25 years studying racial socialization in diverse US families, and her colleagues Celia Fisher and Natasha Cabrera. And this comes from a summary and a synthesis of some of their findings. In their research, they find that many parents instill colorblindness with statements like all people are the same, or are afraid to broach the topic of racism and generally avoid the topic. Black, Latinx, and Asian parents are more likely to talk to their children about race and discrimination, but that's not always true either. And so some of the strategies that these developmental psychologists say help include exposing children to diversity, starting in early childhood by exposing children to peers of different backgrounds, different racial and ethnic groups, different immigrant backgrounds, and to the strengths and traditions of these groups and cultures. To explain simply and directly what instances of racial violence are when children ask, or when things show up in conversation or in the media, of course, taking into account children's developmental stage and what children can absorb, but taking the time to explain pretty simply and directly what these mean in terms of what racial violence is. Instilling the awareness of things like racial stereotyping, the concept that there may be things like microaggressions that children face as they enter school or care or community settings, and then also what racial privilege entails in introducing some of those ideas. And so there are now an emerging set of kind of interventions and resources for parents, and these are, I think, critical in terms of supporting children's well-being, as well as responding to some of the crises that are going on in our society right now. At the community level and for schools, this is a unique opportunity to expand a kind of schooling that is really important to recognize has been spreading across the US over the past 20 years or so, but is still not at scale. And this is an approach called community schools, which is much more kind of multi-service in terms of how schools operate. Now, I think the stories of how schools have responded to COVID by becoming hubs for food distribution, for example, while they were closed down, the use of school buses, as Anna mentioned, as mobile hotspots for internet access, those are great examples of expanding our vision of what schools can do. And the community school approach is to provide expanded health, mental health, nutrition, and family support services based in schools, not making schools pay for all of these, but in terms of partnerships with community organizations that exist. And the same principle holds for community colleges, that colleges with low-income students often have large proportions of their students facing food insecurity. In community colleges, in public four-year institutions, and also even at elite institutions, as a sociologist named Anthony Jack has shown. So, so this notion of expanded services with schools and the education system as a base has shown some evidence of positive impacts, increasing grade progression, attendance, math achievement, and reduced disciplinary incidents, really importantly. So that has relates to this point of providing improved mental health and well-being supports in schools. And this does show that training school staff may be a productive alternative to installing police officers in schools to do things like reduce disciplinary incidents and disrupt the school to prison pipeline. There is actually very little evidence that installing police officers in schools does anything for things like disciplinary incidents in the couple of national studies that have been done. The community stresses and things like inequitable access to the internet, which has resulted in large proportions of students not actually attending online classes because they don't have sufficient internet or access in the household, is limited, entire extended households, for example, sharing one internet connection that might be spotty. This is an opportunity to look to our community and national service programs and expand them. So AmeriCorps, for example, currently has 75,000 members a year. Over the past few months, there have been proposals to increase tenfold. These were unfortunately not in the Democratic Party platform. I think the efforts to expand these would be a terrific response. They could leverage improvements in community infrastructure, food relief, housing, this notion of providing greater access to the internet and addressing other inequities related to COVID-19. There has never been a link of AmeriCorps to college credit, but as colleges are also facing their own reopening challenges, but some students are staying in their home communities or are taking largely online classes, there's a real opportunity to engage them in community service and to make those linked to courses and result in college credit. Tutoring in schools, which would address the great variation in learning levels, especially after, as Anna said, this kind of prolonged summer loss kind of situation that has happened due to COVID. This requires a lot of individualized support, and we know from work by Matthew Kraft and others that tutoring in schools that's provided in a non-stigmatizing way, and that would mean kind of provided to all students and tailored to their individual learning levels and what they're struggling with at the moment, can boost student achievement. And so we could think about an extension of AmeriCorps that focuses on tutoring. Finally, a couple ideas around addressing national inequities and then issues of the national narrative. I think Anna mentioned this notion of cash supplements and emergency cash relief. We know that the first set under the CARES Act has expired, and that moratoria on evictions are also expiring, and this means that we will be facing further job loss, further eviction, further threats, and increases in poverty. And so providing emergency cash relief will be really important, and expanding to populations excluded in the CARES Act, like DACA recipients who have not had any access to the benefits around things like unemployment insurance or the cash stimulus might be considered. Maintaining and expanding food stamps will be critical. There are strong data showing the life course benefits to earnings, to education, to health of food stamps as a national program. Addressing cross-state school finance. School finances might be a really boring topic, but as property taxes plummet and as we have an education system that is based on property taxes, the notion of relief for school budgets, local K-12 budgets, and also community colleges and public institutions absolutely needs to be at the center of a stimulus. And the economists Sarah Reber and Nora Gordon have a terrific plan for pointing out that you can do that kind of stimulus in ways that address long-standing disparities in the United States that are not just across schools within districts or across districts within states, but also across states. We simply have certain states that have historically spent far less on per pupil spending than others. And there are regional differences, and there are ways to address these in stimulus packages. The final example I want to give is a project that I'm engaging with colleagues at NYU. And this is to address some of the other issues around dehumanization and polarization that are going on in society, because I think sometimes we feel kind of hopeless about these. This comes from an initiative called the Project for the Advancement of Our Common Humanity, which Niobe Way and a set of activists and scholars and policymakers have been working on for the past several years. And it brings together the science about the fact that even though as humans we're inherently relational beings, we have unfortunately created a culture that reinforces a hierarchy of humanness in which some are considered more human than others. These are at the root of not just things like our pandemic of racism, but also issues around that are pitting groups against each other, immigrants against the native born, sexual minorities against heterosexual individuals, these kinds of dehumanizing forces. These are responsible for what has unfortunately become a crisis, what we call a crisis of connection, which is that year on year, a decline in reported empathy and trust in others, rising levels year on year in the United States of depression, anxiety, reported loneliness, rises over year on year in terms of rates of suicide and violence. And so we believe that there need to be solutions that are rooted in a counter science of how humans are wired for connection, and that increasing connection and the ability to communicate and see each other as full human beings might disrupt this hierarchy of humanness and replace judgment with curiosity. At NYU, we have been working for the past several years on a project called the Listening Project, which aims to rebuild some of this connection by training middle schoolers in the practice of transformative interviewing and listening. And so the goal is to address the crisis of connection that during adolescence, unfortunately, interpersonal curiosity and connection end up being replaced by judgment and stereotyping too often. And we know that that can play out in social media contexts, and school contexts, and community contexts. And so this is an intervention aimed to kind of combat that decline that is normative in adolescence. And so this involves literally doing the kinds of interviewing, the deep and semi-structured and empathic listening skills that many of you employ as journalists, and training 7th graders in that, right? So imagine 7th graders, you know, and what would happen if you were able to train them in these kind of in-depth, long-form journalistic kinds of skills in listening and interviewing. And so over the course of 5 weeks, they get trained in doing this. They interview strangers in the school that they might not even know, like members of the cleaning staff, not just teachers. And then they spend several sessions interviewing a loved adult in their family, often a parent. And then they write a in-depth biography of that person from these interviews. And I can say at the end of this project, when they present these biographies and their parents or whoever they've interviewed are in the room, it's an extraordinary emotional moment. This project so far has shown increases in perceived similarity of youth with people who are not in their racial, ethnic, or religious or gender group, increases in interpersonal curiosity, and increases in perceived overlap of the self with others. To conclude, that was like a little bit of a patchwork quilt of solutions, but policies that address inequities in economic well-being, education, health, and support for well-being could prevent some of these historic increases in child and adult poverty and declines in health and well-being and learning that go along with them. Community and family supports need to be increased for those who are shouldering the burden of COVID-19 under the onslaught of closures, bankruptcies, and evictions, and efforts to disrupt the hierarchy of humanness by maintaining and building our capacity for relational connection should be at the center of rebuilding the social fabric of our society.